Today, let's talk about what happens during a consult for a brachioplasty. So either with aging or weight loss, you can get some loose skin under your arms that can be pretty bothersome in tank tops or short sleeve shirts. And the surgery to correct that can be pretty straightforward. So today we got a patient that came in, she'd lost quite a bit of weight, and she's got these sort of loose areas under her arms. Here and here. And so obviously we're going to talk about getting rid of those. I like to put my incisions in what's called the bicipital groove. Now this area is that shadow that's right there underneath the contours that you get from muscle definition for the biceps muscle. And what this allows is the incision is then pretty well hidden. Unless you're raising your arm up like this and that incision is here, nobody's going to see it. It's not on the back of your arm where somebody's going to see it if you're standing in line at a movie theater or at the bar. It's going to be hidden inside of your arm. So unless you're at the track and you've just won big and you're waving that ticket in the air, nobody's going to see that scar. So this area of the incision hides inside of the arm here and sort of curves down before we get to the elbow. I try to keep that incision inside of the upper arm area, and then we swing out here. And it's really important to actually take that incision down along the chest wall just a little bit into the armpit. What we don't want is to just make things tight across here and then you end up with some weird banding or flattening of the armpit. We want a nice sharp angle there in the armpit to keep a nice natural look and have really good mobility and really good outcomes. I always add liposuction to my brachioplasties as well. And you can see for this lady, she doesn't have a whole lot of extra fat in her arms, but what we want is to allow this skin to drape really nicely around. We're trying to get around the arm and not just pull it tight. And so the liposuction actually extends all the way up here and then around the arm to really thin things out. I also really aggressively suction right here where we're going to be removing this skin, and what that does is actually removes all of the fatty tissue, but it saves all the little nerves and the blood vessels that are right there under the skin, and so we're saving sensation to this part of the arm. There are nerves that come through here that give you sensation on your forearm that we really want to protect, and so by aggressively suctioning here, and then we remove just the very surface skin layer but save all those important structures below, then we're going to save sensation. And so what you can see here is a nice fine incision that is healed really nicely, a really good contour under the arm, and an incision that's pretty well hidden. Now there's always going to be a scar, but if we can hide it in natural contours, things are going to be great. And so you can see for this lady afterwards from behind how great this looks, an invisible scar. So you can see how large that skin was before and then after, how nice that looks. And so from behind, you're never going to know she had a surgery ever, and this is what we're going for.